No, nothing could. Nothing could can prepare you for something like this.
The pure influx of people, the amount of death and dying, we're so exhausted and so strung out from the amount of patients that you have that you're not able to give the care that you would normally want to, and the time with the patients that you would normally want to. It was unparalleled to anything that I've encountered in my nursing career.
Local hospitals have been treating COVID patients every single day of the pandemic. The surge over the fall and winter filled ICUs to capacity.
Usually our ICU covers 18 patients only for the medical ICU. I think just in the ICU part alone, we are up over 25. May not sound like a lot, but when you're talking 25 of the sickest patients you've ever seen in your life, that makes it exponentially harder.
We were all just picking up slack. We were leaning on each other. We were sweating with each other, crying with each other. I think to some extent the mental aspect of COVID is going to last with, millions of Americans, of course, but especially in the nursing and medical community for some time.
They saved lives, and often, after weeks of care, they lost lives too.
I remember having them on a mask to help them breathe. And we were supplying 100% oxygen and as much pressure as we possibly could through this mask to keep them from being intubated. And he kept on asking when he was going to go home. The next day we had to put him on the ventilator. 2 weeks later, he was no longer with us. He kind of grabbed my hand and nodded, and that was it. That was the last interaction I was able to have with him. I told him it's going to be okay. It wasn't.
I have always kind of felt that death and dying can be a beautiful experience, and you should be let out of this world the same way you're brought in, and it should be a celebration and surrounded by family, friends, loved ones, and having that element taken away from people was just really hard. I mean, it went away, it goes against every nursing instinct that you have.
I'm going to keep on taking care of patients. COVID or otherwise, that's what I do. That's what all of us are here for, take care of patients. We didn't sign up for something like this, but we didn't back down either.